So today we'll see about this entity which is known as Pachychoroid disease spectrum, and this is a disease which was initially identified and reported by Januzzi et al. In 1982, and since then the evolution of choroidal imaging has helped all of us to understand better about this disease. Now each of the slides has been taken up from various publications, and there will be a QR code along with the images and the text which will guide you to the relevant publication so that you can use this QR code and go ahead and read more about that particular segment of the disease description. Now this will be a series of lecture, and when I was making this lecture I was understanding that this will be important to first of all introduce the keywords to all of you so that it is easier for you to build upon the knowledge. So we'll see the keywords which are required for understanding Pachychoroid disease. Now as there's one keyword which is double layer sign on OCT, so optical coherence tomography as you know it has provided us with new insight in the disease process involving retina and deeper layers of retina. And here we will see that what is a double layer sign. These are the images which show a fluorescein angiography and a ICG angiography along with the OCT image. And as we proceed further, we'll see that this is what is understood by the double layer sign. Usually on a OCT, the retinal pigment epithelium and the Bruch's membrane, they appear fused. But when there is a separation between these two layers, they are seen as a reflective distinct layers with a space between them. And this cavity may be clear or it may be reflective, having some opaque material in between these layers. Now here in this image we can also appreciate that this is retinal pigment epithelium which has been elevated. This is the anterior layer of the Bruch's membrane, which is indicated by this white arrow, and we can also make out these large blood vessels and compression of choriocapillaries when you compare it to the rest of the area where the choroid is thinner and it has a proportion of choriocapillaries abutting the Bruch's membrane. But in this area where the disease process is started, we see choriocapillaries which have thinned out and there are large choroidal blood vessels here. This is a common denominator for Pachychoroid disease, as you will see further. Now this is a ICG image along with the OCT showing us that apart from these choroidal blood vessels which are large caliber, we can, and this is a portion which is closer to the optic disc, we can see again a double layer sign, but this time the double layer sign has a reflective material deposited in between the two layers, that is retinal pigment epithelium and the Bruch's membrane. Another term which will be frequently encountering is polyps. Now these are recognizable elements on a fundus photograph and fundus evaluation, and they can be seen here as orangish red nodules which represent pigment epithelial detachment, and when they have no associated fluid around them, that is subretinal fluid or subretinal hemorrhage, then they appear like this. And these can be differentiated from ARMD, SRNVM as seen on a fundus photograph by absence of drusens. And on OCT we can also appreciate the difference between the choroid thickness as seen in ARMD patients and these polyp patients. As shown in this photograph, we have a polyp surrounded by a serous fluid, and this serous fluid will have characteristic yellow deposits seen. Accordingly, we can also have a PED, that is polyp, along with a hemorrhagic fluid surrounding the polyp and exudation along with that, seen as yellow spots and deposits in the subretinal space here. The common denominator here would be that the choroid may be thick or thin, but there would be a characteristic loss of capillaries. As seen here on these two OCTs of two different patients, we can see the double layer sign here, as well as here we can see the separation of retinal pigment epithelium from the Bruch's membrane, and we can also appreciate that here the capillary thickness is 130 micron, and here we have which is more than 400 micron thick. But the characteristic finding that there is lack of choriocapillaries in both the images is also obvious here. This is a common denominator seen in Pachychoroid disease, and it may be a sign of ischemia or inflammation which indicates the capillary shutdown. Now there is an entity known as branching vascular network. Branching vascular network are basically the blood vessels which are terminally ending as polyps, and they also can be visualized on ICG and OCT, and these will have a hemorrhagic PED with serous detachment, and this will indicate a PCV here. As you can see here, we have polyps here, we have polyps in these areas, along with a polyp and subretinal exudation in this area, and a serous detachment of neurosensory retina involving this area. On ICG, we can see the feeder blood vessels. If you look at this ICG, which shows us the retinal vasculature and the choroidal vasculature, we can identify blood vessels which are feeder blood vessels which are illuminated or fluoresce in the early phase of ICG. Later on, these branching vascular network which terminate as polyps. So these are the red arrows indicate polyps, and the blood vessels which are terminating at polyps are the branching vascular network, and this is one of the key elements in the subretinal space in Pachychoroid disease. A OCT may show a retinal pigment epithelial undulations along with the double layer sign, indicating presence of BVN or branching vascular network, and at times you can also see that there are polyps seen along the posterior margin of this retinal pigment epithelium. So these elements can be seen on a OCT, indicating a branching vascular network as a part of the Pachychoroid disease spectrum. Another key element is pigment epithelial detachment. Now we all know that pigment epithelium or the retinal pigment epithelium is tightly adherent to the Bruch's membrane, and it cannot be peeled away easily. And here in this image we can see a tall peaked, sharp peaked PED along with a serous detachment of neurosensory retina, as seen by clear cavity here. And we can have various types of pigment epithelial detachment, which can be drusenoid or vascular PEDs, and according to the shape we can have sharp peaked PEDs, we can have a thumb shaped PED which would appear as a polypoidal growth on an end face fundus photograph. Here we can see the double layer sign where you have the choroids, Bruch's membrane, anterior part, and a pigment epithelial detachment which is thumb shaped or a tall pigment epithelial detachment with some hyperreflective material inside. We can have a notched PD, which would be a sign of a vascular element inside the pigment epithelial attachment, and these are characteristically seen in polypoidal vascular choroidopathy. Here we can see this notch at the periphery of the pigment epithelial detachment. On an end face view, this would appear like a donut where we have a ring shaped or a round circular lesion with a depression in the central or paracentral area. Now, along with these keywords, we also have to understand the choroidal neovascular membranes and the classification. So we can have four types of choroidal neovascular membranes. The type 1 is basically the one which is hidden underneath the retinal pigment epithelium, and this would not be normally visible on fundus fluorescein angiography because it is hidden underneath the retinal pigment epithelium, which would be opaque for fluorescent dye and cannot be seen by FFA. And on OCT angiography, we can see these membranes which are underneath the retinal pigment epithelium, and we can also appreciate the dark halo which is seen all around these neovascular membrane. And then we have the type where the vascular network which has proliferated has punctured through the retinal pigment epithelium, and now it is lying in the retinal or subretinal space. So from sub-RP space, that is between the Brooks membrane and retinal pigment epithelium, these membranes can reach, and they have reached to the level of retina now, and that is type 2 neovascular membrane. Again, on OCT angiography, we can appreciate this membrane, which is seen as a more marked reflective lacy membrane here, and we have a dark halo around the blood vessels. Then we have the type 3. So when you have the avascular part of the retina or the avascular zone along the retinal layers, when we have a membrane which has proliferated into this particular layer. So this has penetrated deeper, or rather it has moved deeper into the retinal tissue when looking from the choroidal side. So it has reached from the choroid into the retinal pigment epithelium and then into the avascular part of the retina here. Then we have the type 4, which is basically a combination of type 1 and type 2, and here we can see that a part of the membrane is deposited beneath the retinal pigment epithelium, and some part of it has punctured the retinal pigment epithelium, is lying in the subretinal space or the retinal layers. Now, after all these descriptions and understanding these keywords, the next lecture which will follow this particular lecture will consider the Pachychoroid disease spectrum and the characteristic of the 6 diseases which have been listed in this particular disease spectrum.